Doctors of Reddit, what is a disease that terrifies you but most people don't care about? Hantavirus. Found in rodent waste and inhaled makes you bleed to death before diagnosis. Rabies is nothing to mess around with either. Once symptoms appear, a miserable death is all that's left. At my old apartment, we had a rat problem, and my mom was super worried because I think one of her relatives had died from hantavirus. Got out of that place as soon as I could, and left all the rat shit for the landlord to clean up since he didn't want to hire an exterminator. Doctor here. Strokes. Risk factors include most of the pre-existing condition that nobody seems to care about: hypertension, diabetes, smoking. And once you get a stroke, it can be extremely debilitating and life-changing. I have seen people go from, "But grandma was fine, just a touch of the sugars," to, "Grandma now can't move, talk, or feed herself." The fact that 1. Your life can change from 1 minute to the next, and 2. The fact that you are basically a prison of your own body afterwards is just terrifying to me. There are 2. Locked-in syndrome would be so utterly tedious you'd want to die, especially if it was misdiagnosed as a vegetative state. Severe central pain syndrome is so awful, people with it frequently do kill themselves. Doctor, currently in residency. I'd agree with prion diseases that were already mentioned, but a terrifying one that is not as known is HSV-1 encephalitis, caused by the herpes simplex 1 virus, which is incredibly common, mainly known for causing cold sores. HSV encephalitis affects all age groups, and almost always leaves people with significant neurological damage or personality changes. The exact pathogenesis is not known, although immunosuppression may increase risk. It's rare, but the fact that there is not much of a warning to it and the fact that it can permanently change your personality and leave you with long-term neurological symptoms, even with early treatment with antivirals, is terrifying to me, especially with how common HSV-1 is. Alcoholic hepatitis, acute liver injury from alcohol, and cirrhosis, chronic liver injury. We do not really have any treatment for it beyond steroids that only sometimes help in the acute period and supportive care. Not entirely clear why particular alcohol toxin exposures result in the acute injury, i.e., some people may be heavy drinkers for a lifetime and have no major acute hepatitis episodes, whereas other people aren't even heavy drinkers and just one bad binge send them over the edge. Our ICU is often filled with chronic liver cirrhosis patients awaiting transplant, and the vast majority do not make it to that point. I myself was diagnosed with alcoholic hepatitis last June. I was only 24. I had been drinking 1 bottle of rum a day for 3 weeks, maybe. Then all of a sudden, my eyes were piss yellow and so was my skin. Luckily, my mom visited me by surprise one day, noticed and rushed me to the hospital right away. After 3 or 4 days in the hospital, my belly started to distend, my ankles swelled, and I was in horrible pain. I was confused on why I wasn't getting cured. They drained 7 liters of fluid from my stomach. Long story short, I spent about a month in the hospital. Then they sent me home on hospice care, I guess to die, because I wasn't getting any better. The steroids they ended up giving me, prednisolone, really helped. Then I guess my liver started to heal on its own. A year and a half later, I have no signs of liver damage. I'm so lucky. Prion disease, specifically fatal familial insomnia. Imagine one day you can't fall asleep for some reason. Within about 18 months, you'll be dead, and there's absolutely nothing you can do to stop it. Med student here. Leach-Nyhan syndrome is something I wouldn't wish on anyone. Most people have never even heard of it before. It's an error in purine metabolism. This syndrome has a ton of symptoms and comorbidities, but one of the most shocking is self-mutilation. These babies often eat their own lips, fingers, and hands. They also tend to slam their heads against objects. They often have to be restrained and either have their teeth removed or wear a mouthguard. Older people with the disease often ask to be restrained because they have no control. What makes this disease even worse, though, is these individuals are not insensitive to pain, so they feel the pain as they, in lack of a better term, eat themselves. Not a doctor, but my mom's side of the family is plagued with Huntington's. If one of your parents has it, then you have a 50-50 shot of getting it. It is legitimately a concoction of Parkinson's and Alzheimer's in one. I've already seen the involuntary twitches and restlessness of my mom while she sits and watches TV. Definitely don't want to get tested to find out whether I have it or not. I used this example in university for context. Write your name down on a piece of paper, and then try doing the same thing while constantly shaking your arm. Something as simple as writing your name or dialing a telephone become nearly impossible tasks. Medical student here, I second just about everything that has already been said, but I would like to add another, technically less serious illness: epilepsy. Specifically, that which produces the classic grand mal generalized tonic-clonic seizure. The guttural groan that patients let out as they lose control of their muscles is quite frightening the first time you hear it. I recommend watching a video on it. There are many. This all being said, understanding the condition makes it less scary, as you know the medical reason why people shake, roll their eyes back, have their lips turn blue, etc. Med student here, not really a disease, but antibiotic resistance is the bigger challenge we have in our future. Bacteria are evolving to being more and more resistant to drugs. Some have already reached a point where some strains are resistant to all our drugs. Luckily, this process will take decades to happen on a large scale, but we should not really speed up this process by taking antibiotics when there is no need and not finishing a complete course of antibiotics. If the doctor told you to take 8 pills, 1 a day, I don't care that at day 5 you feel fine and can run a marathon. You still have 3 pills to take. Otherwise, you are just selecting the stronger bacteria that resisted the first 5 days. We should arrive prepared with new antibiotics and/or a completely new kind of drugs and not fuck them again by using them wrongly. A word with no antibiotics is a word where you can die for things that nowadays are visit to your GP stuff. Ophthalmologist here, I'm scared to death of retinal detachments. You could have 0 risk factors, be completely young and healthy, and just one day wake up blind. They can come out of absolutely nowhere. As an eye surgeon, if I wake up blind in one eye, I won't be able to operate anymore. There goes years of training and years of school. It's terrifying. By the way, considering the number of people reading this post, such as yourself, I wouldn't be surprised if one of you wake up blind tomorrow morning. Not sure if this counts, I'm not a doctor, but my mom is. In one of her frequent don't do drugs talks when I was a teenager, she told me about serotonin syndrome, which sounds scary AF and can happen apparently if you take ecstasy while on certain antidepressants. I do the exact details, but it involves a really high fever and fucks up your kidneys. Some people die from it. It's really rare though, and luckily did not happen to me, despite having used aforementioned drug combination. Not a doctor, but ALS. We have all heard of it. It's the disease Stephen Hawking had. But it's a horrible disease. My brother's father had it, and he lived a little longer than they said he would. At first, your speech becomes difficult, sort of like those days when you're tongue-tied and can't predicate your sentences. And it gradually moves to your skeletal muscles. You lose your motor skills over time, and then, at some point, you'll become wheelchair-bound. From there, it's just a matter of time until your diaphragm and respiratory system give in. It's a horrible disease, and people should really realize that. Pregnancy. Not only the bazillion complications that can happen, but the entire process of childbearing and childbirth itself. The normal, physiological thing is to have your organs get squished for 9 months by a parasite, which releases hormones to make you borderline diabetic. When the parasite wants out, you essentially go through the 9 circles of hell, trying to squeeze out a bowling ball through a 10-centimeter canal with fuck tons of nerves around it. Then the bleeding, the smell, the lacerations. Yes, but then you have the adorable baby, and you're left alone to heal while wearing an adult diaper for weeks on end, while squeezing water over yourself instead of toilet paper, and your breasts are so full of milk they hurt to touch, but your baby chomps down hard enough to make you cry. And then you can get infected milk ducts, which radiates pain through your chest, and you have to still feed your baby, or at least pump. And the hormones can give you postpartum depression for months and years, while you're physically and psychologically healing and most likely working so you have money to keep a roof over your head. Not a disease or a medical doctor, but I knew a chemist that absolutely hated working with hydrofluoric acid. Over the course of getting her doctorate, she saw several people get HF burn, and they were really nasty. This is your official warning if you Google them. They can get really bad if you have a high concentration of it. Not a doctor. I'm terrified of heart attacks. The physical symptoms of my anxiety and very strong and persistent. I can spend days with a numb left face, a vice-like grip on my arm, and the top of my head prickling like it's on fire. I also have bradycardia problems, hours, days. I'm worried one day it's going to be a heart attack and I won't realize it until too late. Focal dystonia. I am a doctor, however. My doctorate is in music performance with a minor in musicology. Before you give me shit, the post did not distinguish between asking medical doctors' opinions from doctors in other fields. Cluster headaches or trigeminal neuralgia, feeling like your head is about to explode or constant electric shocks would be awful. As for things I've experienced from worst to least, abscess tooth removal without freezing. My tooth shattered and needed 25 pieces extracted. Halfway through the surgery, my freezing ran out. Appendicitis. It's a deep pain that I can only describe as intense. It's like your insides are crapping a cactus. Jellyfish stings. I was swimming in the Pacific in Mexico and got stung across the back. Red lines for 2 weeks and an extremely painful burning sensation. I'm guessing it was box jellyfish. Thankfully not fatal. Collarbone broken in 2 places. Motorcycle crash, 80 kilometers per hour, high side into a concrete barrier. I hit head and left shoulder first. Helmet exploded on impact and I lost 3 months of memory. I still have some memory issues, but being rolled by the fire department onto my broken side to get me on a stretcher sucked. LOL. They did it 2 more times in the hospital before I had my x-rays done. Burns. Acid, fire, steam, hot metal, red-hot battery jumper cable on 2 dirt bikes. Fun story, LOL. Pediatric cardiologist. I can think of a million esoteric diseases that would be a bad way to go. The risk of living is dying. Any organ can fail from any number of causes. While we are fairly good at diagnosis, the diseases that bothered me were the ones I felt least able to do anything about. In my general pediatric residency, the cases of anorexia nervosa really bothered me. Sure, we could hospitalize a patient, stick a nasogastric tube, and work on the patient's nutritional status, but how could you change the workings of the mind? We would have the same children admitted again and again. There is an inherent selection bias from my perspective. As a resident, I worked primarily on the inpatient setting, meaning I would see the sickest patients. I did not get the counterpoint exposure of the outpatient successes. As a pediatric cardiologist, despite seeing very ill children with heart conditions, I at least felt that I could do something about it. I remember feeling so utterly helpless when managing the children with eating disorders. Fatal familial insomnia. It is hereditary and first symptoms, problems sleeping through the night, usually occur at about 40 years of age. After that, patients gradually start to go insane. Panic attacks, paranoia, symptoms of psychosis, until dementia sets in and they die after about a year or 2. There is no cure or treatment, and the thought of losing the ability to sleep is just terrifying to me. Tuberculosis. It's a sneaky bastard slowly coming back, more and more with a bunch of nasty resistances that make it almost impossible to treat. There are illnesses that feel worse, and deaths uglier than drowning in your own blood. Rabies, shudder. But epidemiologically, it's iffy.